just waiting for some folks to hop on, and we'll do an update for about 15 minutes and take some questions from the comments. And I have an update for you. So just waiting for some folks to hop on. Okay, so we're a little over 100 folks watching right now. So again, this will be on our timeline after this is finished, and we'll turn the closed captioning on. A couple things, and we'll also upload that to our YouTube channel. So a couple of things just to start out. We're still at 19 cases as of right now. We're updating those case counts every day. So that's 19 cases that have ever tested positive for COVID-19 in St. Francis County residents. So I know there's some questions about how the numbers are broken down because we do have 3 people who are considered recovered at this time, which is great news. But that doesn't change that total case count of 19 because that's how many people have ever been tested positive for COVID-19 in St. Francis County residents. So that number will never decrease. It will only increase as more people are testing positive for COVID-19. So that's important to know on how those numbers break down. But yes, we do have 3 people who are considered recovered. I think we'll have more of those in the next couple of days of people who are kind of on the brink of being considered recovered. But remember, recovered is different from recovering. So we have several of our cases that are recovering and are getting better every day. However, to be recovered, remember, you have to meet those 2 criteria of being 7 days out from symptom onset and then 3 days of symptom recovery. So without the use of fever-reducing medication. So they're a little bit different. I've had a lot of questions about male versus female, and it is interesting because 5 cases of our 19 are male, 14 are female. So that seems a little different in the way of percentages than what maybe you're seeing in the state numbers, because the state numbers are fairly evenly split. But remember, we're also dealing with a really small sample size. So 19 cases isn't much compared to, the state cases are over 3,000 now. So you're dealing with a much smaller sample size and really small numbers. So I think it's too early to make any educated assumptions about those numbers and the percentages of gender in those. Now, that being said, we know that females tend to seek medical care more often than males. So that can somewhat play into those numbers a little bit as well. I got a question about blood donations. There are blood drives happening still. It's still very important to donate blood. They take precautions in these blood drives, and they know what their protocols are. So it's still safe to donate blood if you're able. Certainly there's a blood shortage, so we would encourage people to donate. But if you will go to redcross.org, you can look up the local donation sites, and we do have some that are coming up. So if you go there, you can sign up and get a time. And those are still very important. I talked on Tuesday about cloth coverings over your face in public because that's now a CDC recommendation for all people. Now, children under the age of 2 and under, should not wear cloth face coverings. This is on CDC's website, so I wanted to make sure that was known. But all other people are recommended to wear cloth coverings when going into a public setting. Want to talk a little bit about the Easter holiday because, obviously that is this weekend, and with all of the restrictions, we know that it makes it hard to worship in the way you normally do, to gather with your family in the way you normally do. And life is temporarily different than what it usually is this time of year. So it's important to understand that, those social distancing guidelines, gathering requirements are still in place even at, this time of the year when this is such an important time for us to worship and celebrate with our families. But it really is important that you continue to stay home. There's lots of guidance out there about this, and we've put some stuff out to the media yesterday about the Easter holiday, because there's ways to still worship even if you can't go to your large gathering at your church like you normally do. And we want people to continue to worship in the way that they can, that's safe for them and safe for their loved ones. So that might be a lot of the churches are doing drive-in churches, which I think is a great alternative for now in this time. And we would just encourage people to stay in their cars. But I think that's a really great alternative. Of course, lots of the churches also do live broadcasts, so that's another way to partake in worship in a safe way that protects you and the community. Gathering with your family. The recommendation is that, if you're going to have some type of family gathering, that it's with the people that live inside your house. So you might be used to, gathering with people, your parents or grandparents, other members of your family that don't necessarily live in your house. But there are some options. I mean, we've talked about before about, this is an unprecedented time, and we are lucky to some degree that we do have technology on our side. So we can still communicate with our family and do video chat, and all of those sorts of things that technology allows us to do. So that's another way that you can, have your gathering, but yet some of that gathering may be done via a screen, similar to what we're doing here. But again, this is all in an effort to protect your family, protect the ones that you love the most, and protect our community. I would just, encourage that, you remember that although this is a difficult time, we're all going through this together. And unfortunately, we have to make changes, especially the next 2 weeks are going to be very crucial for us to continue social distancing and prevent, slow the spread of disease in our community. Yes, we only have 19 cases, and that's still a fairly low number, and we're happy about that, but we still expect to see more cases, and we don't quite know for sure when we're going to peak. It could be a few weeks out. So we still need to be taking those precautions to protect the ones that we love the most and protect the people in the community and the most vulnerable. Okay, we'll put some other posts out later about Easter too, just kind of some tips for gathering and religious and worship gatherings as well. And then I'm just going to scroll through the comments and try to answer some questions. Try to scroll back up to the top. Are the 5 people who were hospitalized still in the hospital? How long was the average hospital stay? I don't know for sure on how long the average hospital stay is. I can look and into our data and look and see about that. But only one person is hospitalized at this time. So the others have been discharged. And like I said, remember that fully recovered is different from recovering. And so I would say overall, all of our cases are on the track to recovery. But it's important to know that being fully recovered is different from recovering. So we have 19 cases now. Somebody had asked that. Can we show the decrease as an additional column to the zip code list? You can kind of take that data and make that deduction just based on the number of recovered. We just typically when you look at the state's numbers of 3,300 or more now. So those are the same meaning there of those are anybody who's tested positive for COVID-19. So their case counts are never going to go down. They're going to go up. And I don't think the state's including the number recovered yet in their number, and some of that data is hard to pull from their system. So, but we have access to that data in real time because we do the investigation, so we're able to include that data. But that's really what those numbers mean. So similar to how we report flu cases, flu is reported differently. We don't typically do investigations on flu unless it's a flu death. So you're seeing more so tallies of numbers, and we do that on a weekly basis through the year, but especially during flu season. So October through May is our enhanced surveillance time. So those numbers, you never see those go down, they only go up because we're not really looking as much at recovery as we are of lab confirmed cases. Scrolling through. Someone asked about the 5 that are in the 63628 zip code and if they were related to the Bon Terre wedding. So I've talked about this a lot, but only 1 out of our 19 cases have been associated with the Bon Terre wedding, and that incubation period is over. That's not to say that at some point we won't have somebody that ends up being connected in some way. But at this time, only 1 of our confirmed cases is associated with that exposure. Are parking lot services okay? You may have asked that while I was talking about that, but yes, they are, as long as you stay in your car. What is the average time you are seeing people getting their results back? So this is kind of fluctuating day to day. At first, it was long, like 7 days. And then we kind of had this uptick in capacity, and so we were seeing maybe 3-4 days, some even shorter than that. And now, as testing is increasing and people are going to get tested, it's getting longer again. So we've been seeing several days, kind of around the week mark. Now, I was on a call on, I guess it was Tuesday afternoon, and they were talking about the rapid testing. And the priority for rapid testing is going to be rural areas. Now, that was the state who was talking about this, but they said that the priority is for rural areas because these lab companies have to commute. So, when they get these tests, especially in the rural area, they've got a distance to drive to get that to the lab for analysis. So, it is my understanding that we should be the priority to get rapid testing. Or that's what it was on Tuesday anyway. Yeah, testing, I know is, I think, an ongoing, it's going to be an ongoing issue, but the testing sites are at the provider's office, so that's who's testing right now. And then even the Parkland Urgent Care, I know, is testing, and I believe Convenient Care is testing as well. So you want to call them ahead of time, talk with them, they can tell you if they have that test available. I spoke about antibodies on the previous video, the antibody test. I don't think that's a test that's in use locally right now, but that's possible. IgG, IgM tests for antibodies. What about country days? So that's a big question. I actually have a call about that here in a few minutes. I'm not sure. I'm sure we're going to still be seeing disease transmission at that time, but I do have a call to discuss that with the organizers here in a minute, just to have a conversation on that, so I'm really not sure about that. When is COVID-19 going to be over with? There's no good answer for that. The sooner we all listen to the recommendations and follow those social distancing and gathering requirements and limit our social interactions with other people, the sooner that can be. But disease transmission is still occurring, and I think it's too soon to tell an exact date of when those things are going to be over. Just looking at my time here. Is there any correlation between the severity of COVID-19 and blood type? That has not been substantiated. I know there's lots of rumors out there, but that has not been substantiated. And I know that hasn't been the case for some of our cases. But again, there's no scientific evidence to prove that. How long do you think the stay-at-home order will last? Well, the statewide order is through the 24th at this time. I think there's a possibility that will end up getting extended. I don't know any inside information. I'm just saying that I think that if we continue to see disease transmission and cases are increasing rapidly every day, I think it's possible that could be extended. The St. Francis County order is until further notice. So we're evaluating that every day. We're talking about what the transition looks like to go back to normal life, because I don't think that it will be as simple as, okay, everybody go back to, gathering and gatherings more than 10. I think it's going to be a little bit of a transition. So again, I think that's another thing that's hard to say, and it's going to be based on what we see with disease transmission. Should neighbors be having company over every day that enters their house and stays? Is there anything that can be done about that? So everyone needs to stay home as much as possible. We know that that's not always easy to do, especially if you have people that you care for, or family members that need a little bit more care, that type of thing. So I don't know what the exact situation is that you're referring to, but everybody really needs to stay home as much as they can, and limit your movement in the community as much as you can. But certainly that is the encouragement. And again, there are the gathering requirements and restrictions of less than 10. Are our hospitals full? Our hospital locally, I don't ever like to speak on behalf of another agency, but I talk to Parkland every day. Our staff talks to them multiple times a day. We have a very good relationship with them. So right now their capacity is doing good. They are not full, as far as at least COVID patients go. But they're doing okay, and they're meeting every day. They're having conversations with BJC and other medical systems every day, and keeping an eye on what their capacity is and what their level is in their hospital. So they're doing well, and they're doing lots of preparedness activities and utilizing resources, and we talk with them every day. I've talked a little bit in the other video, the video from earlier this week, about kids going back to school. So I'd ask you to kind of review that, but again, too early to tell. Could there be false negatives in a test? It's not impossible, but the test has been proven to be very accurate. So most likely it is extremely accurate. We've heard that hot, humid weather in Missouri can kill this virus. Is that true? That has not been fully substantiated yet. I have read a study recently. I think there's more studies that need to occur on that, but that has not been substantiated at this time. Now, there's been lots of discussion, even by the Coronavirus Task Force at the federal level, about the possibility of this becoming a cyclical type of a virus, similar to what we see in the flu, with having a flu season. And that's why it'll be really important for the vaccine development. But I think that has not been substantiated at this time. Smart News says we have 20 now. We do not have 20, we have 19. Our numbers are updated every day at 4 p.m. Every day around 4 p.m. we update the numbers. We update the number that we have that have fully recovered. Some of those numbers and exposure might change a little bit because we might have new information through our investigation. We're touching base with these cases every single day, even after we've done that initial investigation. But we update our numbers every day at 4 p.m. and we have the most up-to-date numbers. Okay, I'm gonna do one more. I'm over on time here. This is a good one. This will be my last question. So, what about local gyms being open? Shouldn't they be closed? So there's a couple things. So in the statewide order, there is an allowance for non-essential businesses to continue to conduct business if they can maintain social distancing, gathering, and hygienic practices. So again, that is the allowance for non-essential businesses to continue to serve the public in whatever capacity they do, if they can maintain those types of things. Our order has a Article 4 is the innovation piece of that order, and it basically says a similar thing. If you can prove that you can maintain social distancing and all of those requirements, that you have to ask for permission to be able to continue on with your business. So we're working with a couple of local businesses that we need them to get approval, that they don't fall under any of those exempted businesses. However, I think it's a tough one. I think there are ways that gyms can continue to operate, and we've worked with some of those, but they have to be very stringent in the way that they allow people in how they are going to social distance. People have to stay 6 feet away from each other. and then their hygienic practices. So it's not impossible, but we're looking for very specific plans from those gyms that continue to operate, and those have to be approved by the health department, and we're working on some things locally on that level as well. Okay, I'm going to hop off here. I've got to get on a call. I appreciate you guys all being on. We'll have some stuff out about the Easter holiday on Facebook, just some information and tips on how to worship safely and gather with your family safely. We appreciate everybody's help in this. I know that this is a difficult time, and I know you've had to change your way of life. And I assure you at some point this will be over and this is temporary, but I understand that this is not an easy time for anyone, and we've all had to make adjustments, but you're making a difference. I know that, again, it's tough, but you may never know the life you save or the life you affect, but every decision we make, to go out into the public or to go against those guidance or to follow those guidances, that really does make a difference. So I would encourage you to continue listening to the guidance that's provided by the task force and the CDC, and we appreciate you. I hope you have a happy Easter. And if you have questions, comments, concerns, please reach out to us via phone, 573-431-1947, or via our website on the Contact Us tab. We are closed for Good Friday. That's a normal holiday that we are always closed for. However, we will still be doing disease investigation through Good Friday and through the weekend. We're doing that 7 days a week with COVID-19. So appreciate you guys being on. We'll go through the questions and update our frequently asked questions list. So thank you.